Albertans will remember on September 9th when Chief Medical Officer Dr. Dina Henshaw admitted publicly that her team had screwed up their COVID-19 planning model. They used the wrong assumptions, and that was one of the reasons why the government had backed off on pandemic management measures, which led to a lot more infections and then basically overran the hospital system. So modeling turns out to be a big deal when you're setting pandemic policy. So the question then arises, how hard is it to get it right? Well, you know what? I have an answer for that, and you're not going to like it, especially if you're from Alberta. So I'm going to talk to Dr. Gosia Gasperowicz from the University of Calgary. She's a modeler, and she does this kind of work all the time. Welcome to the interview, Gosia.
Good afternoon. Thank you very much for inviting me. I'm happy to be here. I'm not a modeler. I'm a developmental biologist. I'm doing models because I know how to make them.
Fair enough. So you do models. That's close enough for us. Look, I just want to ask the simple question: how hard is it to get an accurate prediction of COVID infection rates?
It's pretty easy. So the fact that predicting that there will be a wave is pretty straightforward. Predicting how fast the growth rate will be is also pretty straightforward. Especially now that we are already 1.5 year into the pandemic, it's easy because we know so much about how this virus spreads, what is the dynamics of growth, and no matter what methods you use. For example, the modelers from BC are using statistical modeling. I'm using more like basic science methods, so observing the world, observing the data, observing the parameters, observing what are parameters of the virus growth from different jurisdictions, and then extrapolating the growth on the base of that. And it's pretty straightforward. Like, some people can do it on the back of the broad brush stroke on the back of the napkin, basically.
Well, look, since I started looking into this, I interviewed Dr. Paul Tupper from Simon Fraser University, the BC COVID modeling group. And on August 13th, they had produced an accurate study that predicted what would happen in Alberta. You have a colleague that had made a dead-on accurate prediction of this. You've made dead-on accurate predictions of this. It seems like the only people in the world who can't get it right are modeling in Alberta Health Services.
Yes, it seems so. And the problem is that they don't, if they see the models of other people and two other groups have different results, the appropriate action would be to think like, hey, why is our modeling different than yours? Like, let's figure it out before we make just life and death decisions.
Well, I think that's a very good point. If people have died as a result of decisions that were made on inaccurate modeling, so this is no trivial matter here. And Gosia, is your modeling, your calculations, and those of your colleagues posted online? Are they available to the Alberta Health modelers?
So mine were published on Twitter. And I know that the premier seen my models because he referred to them in his speech back in summer as that they're models made by some person on Twitter that showed the fourth wave. And I was the only one publishing like this, so I was this some person on Twitter. Also, yeah, so that was available. Professor Caroline Collin made models back that were published on Globe and Mail on May 31st, and they showed different scenarios also. So they showed the scenario that what will happen if there will be immune escape of the virus what will happen if we have too fast reopening, and both showed both showed the fourth wave in the fall, and what could happen if we have gradual, slower reopening. And if we would have gradual reopening, we wouldn't have the fourth wave. That's also what my models showed, that if we would just continue in May, after May 26th, if we would keep schools closed for extra 5 weeks till summer holidays would start, and if we would just continue what we've been doing, plus adding, then even without adding extra vaccination, then we would stop all community transmission by the end of July, basically by July 22nd. With vaccinations that were ongoing, probably it would be faster. So we've been just several weeks from the scenario of New Zealand, so having no community transmission, basically living in zero COVID.
Okay, well, look, I reached out to Alberta Health Services and asked for comment, and one of their communications persons sent me a comment, so I want to read part of it here. Alberta Health monitors a wide range of research. So we know now that at least there were 3 modelers, including you, who were getting it right and their information was public. Alberta Health says it monitors them, so it was aware of that research and perhaps other research as well, or other models as well, and yet they still got it wrong. I'm not quite sure. I'm sure there are many Albertans watching this going, how did that happen? Any insights that you can provide?
Well, I guess they just actively ignored us, actively ignored something that is not confirming their decision. So it's almost like their model fits the decision that was made to reopen everything as fast as possible and make a model accordingly. I don't know. So I don't know how much I would need. So they said that they miscalculated. I would have to put a really strong effort to miscalculate like that, to make this thing being lower than it was.
So it's very difficult to make the kind of error that they did, which speaks to perhaps the level of incompetence, but we don't know. But nevertheless, you made the point that it almost looks as if they arrived at a decision, a political decision, a cabinet decision, a departmental decision, but the decision was made to open things up, and then the model was adjusted to justify the decision. Is that?
I mean, it looks like that, because if you would be a scientist really, or honest person that wants to avoid a catastrophe, and your results show something totally optimistic, and even not totally optimistic, because even they showed the fourth wave in their model, right? So while the communication was that there won't be fourth wave, so there is something not correct there. But if my model would show something very like mildish, and everybody else models show something more dangerous, then I would consult. I would say, hey, people, like, what were your assumptions? What did you put in your model that it looks more scary than my model? I don't want people to die. I don't want hospitals to be overwhelmed and collapse hospital system. So let's figure out what's going on. And that's something they didn't do. Like any manager who wants the company to go right and not to have a disaster would do something like that. So the fact that they didn't is really concerning.
Right. Yeah. Right, and then so let's flip that around. One of the ways that they could, not only do they, read your research and that of others and reach out to people, but you're suggesting that they should have put their modeling up on the web, and they should do that modeling every day. They should update it every day, and they should make it publicly and transparently available for other modelers to comment on, and that would get the best product leading to the best policy. And yet they don't do that.
Yeah, absolutely. That's something that should be done. We should have models at least like every day, the best, but like basically like weather forecast, either every day or at least once a week, knowing, okay, if we continue what we are doing, where we are heading in 2 weeks from now, 1 month from now, 3 months, 1 year, 5 years. So people know what they are deciding for. So first of all, other scientists can comment on it and see if it's done correctly. And the second thing is citizens, like we are all stakeholders here, like know what open for summer means. like, hey, maybe we shouldn't have open for summer if we're gonna to have fourth wave. Even fourth wave, as predicted in the model by Alberta Health, by the government. Maybe people wouldn't like something like that, but people were told that there won't be fourth wave. So such models should be published basically at the end of May, where the decision of stage 1 reopening was made. And not only model, if we do this, what will happen, but if we do something else, what will happen? So showing like at least 3 scenarios. So, okay, if we don't open now, but in 5 weeks from now, then we won't have spread anymore and we won't have fourth wave. So now you people can decide, like, and then can be a public discussion and citizens can decide what they want.
Now, Hinshaw, Dr. Hinshaw came under a lot of public criticism for not releasing the calculations in the work that went into making policy decisions. And she promised she would release it. And then that took her weeks and weeks and weeks and weeks before she finally did. And when it landed, it was very underwhelming from the response that I've seen. Did you happen to have a look at the work that she did release that was used to justify the open for summer policy?
So some arguments from Alberta Health are that they assume that there will be a decoupling. They looked at UK. And they claimed there was a decoupling of cases from hospitalizations, but I don't know. They probably heard some gossip because there was no decoupling. So decoupling means that like cases go up, but hospitalizations stay flat. That was not what was happening. So from basically May 20 till July 21st, cases grew exponentially in the UK. And hospitalizations grew exponentially from May 27th to July 27th.
So hang on a second. This is not something I'd heard before, and this is fairly damning. I mean, what Hinshaw said in press conferences is we used the assumptions from the UK in our modeling, and they were decoupling between infections and hospitalizations. And you're saying even that data was wrong. They got the very basics wrong.
Yeah, they got the very basics wrong.
Wow.
So what was happening in some moment in UK is that the proportion of hospitalizations to cases changed. So it was 4 times lower than in the previous wave. But 4 times lower means that you have just two doubling times to get to the same number. So it's not decoupling, it's the ratio changes, but cases grow, hospitalizations grow. So you cannot talk about decoupling there.
Wow. I have to tell you, that is a real eye-opener, because it throws into question everything that the Dr. Hinshaw said. And frankly, as a modeler, I mean, I can say that it destroys my faith in the Alberta Health modelers and any claims that Dr. Hinshaw would make about modeling going forward, being the basis of Alberta policy. But you're the expert. Would you have confidence in the next modeling that comes out of Alberta Health, especially if they don't post it?
Not at all. I wouldn't have confidence.
Well, Gosia, so what does this portend for the future? I mean, is it possible that we're going to be stuck in this, COVID pandemic forever? Or, is there a scenario where we can actually end it?
So there is a strong scenario that we can possibly end it. And it's if we adopt elimination strategy. So every region that adopted elimination strategy managed to stop the community transmission and had much better outcomes than we have. And it's Atlantic Canada, many states in Australia and New Zealand, are also Taiwan and mainland China. But what New Zealand is still doing, like now they have lockdown, but they managed to bend the Delta curve. And the cases are going down. Even with Delta, they have only 30% population fully vaccinated, yet they were able to do that. While Israel which is much more vaccinated, is still struggling and cannot bend the curve. And the problem is that if we don't eliminate the virus, if we don't stop, so eliminating is short lockdown that can stop all the transmissions, and then people can have freedom again. Like in New Zealand, people in New Zealand, except of 2 strong lockdowns, they have in between, they had much more personal freedom than we have in Canada since 1.5 years. So when you eliminate the community transmission, you are in a very safe place. And basically you can avoid disaster which we have now. And like this, we can avoid 5th wave and continuing roller coaster of waves. And it's absolutely doable if we do it as our province and all other 5, like all 6 provinces that have COVID. If we continue like Atlantic Canada, then we can end the pandemic in Canada.
Well, Gosia, thank you very much for this. Really appreciate your insights.
Thank you very much for inviting me.